Thanks, Buhle. The Competition Commission is set to announce a substantial reduction of COVID-19 PCR test prices. The announcement comes as companies and universities increasingly introduce vaccine mandates. People who choose not to be vaccinated have to have regular COVID-19 tests at their own cost to maintain access to work and other institutions. In the United Kingdom, all COVID-19 PCR tests are free. However, you are required to pay for a PCR test for UK travel, regardless if a person is fully vaccinated or not. PCR tests are free in the public health sector in South Africa. Now, joining us for a comparative analysis on costing of the test is medical science researcher Patrick Jolomba. A very good morning to you, Patrick. Thank you so much for your time. Testing is a vital part of the response to COVID-19, yet the process and the costs are simply unaffordable in South Africa. What have you found as you have perhaps looked at the overall picture and the different countries when it comes to addressing the scourge of COVID-19?
Good morning. Good morning, Paul. Good morning to viewers and listeners. And indeed, Merry Christmas, because it's just around the corner. Yeah, going right to your question, there's a big difference between what is happening in Europe, in the UK certainly. There's a big difference in terms of what is happening in Africa. And I'm saying Africa because, I mean, Africa is a continent. So you find and you hear that in South Africa, these tests, you had to pay so much money for the test to be done. And as you've just rightly alluded to the fact that in the UK, that's certainly, free. And that makes things a lot easier in terms of analyzing statistics to see how many people are truly infected by the virus, but also in terms of analyzing the particular sort of strain that is dominant around the country. So there is that inequality, of course, in terms of not just the vaccine distribution, but certainly in terms of the testing as well.
What are the big differences when it comes to a COVID-19 antigen test and the PCR test in terms of really detecting COVID-19 in someone?
There are different types of tests that can be done, to test, the positivity or negative of the virus. And one of the most common ones that tend to be used is what we call the lateral flow test. That is a simple, quick test. You stick it up your throat or nose, and then it can give you the results within a few minutes, around about 20 minutes. And it's generally quite cheap. And as I've said also, here in the UK, that is, free, to anyone. You can literally just, go online, book a test, and then you get your kit, from the nearest pharmacy. So this lateral flow test has been said is not particularly accurate. However, it does give a very good idea of what is actually happening. So it does give you an idea that you could be having a virus or not. Then there is the PCR, the polymerase chain reaction PCR. That is a test that is normally done in the lab. So the test can be taken in a similar fashion whereby you stick the swab nose or throat to determine that, and that's normally sent to a testing center. And that really takes time and is a lot more accurate, almost up to 90% accuracy level on that one. So that is really important. And this particular one that I'm talking about is the one also that we can utilize to look at, sequencing. What kind of, variant are we dealing with here? That is, identified from this and is no way identified from a lateral flow test. So the final one, the antigen test. So normally that tells you whether you've actually, had a virus or you've acquired a virus, you've been infected in the past or not. So it doesn't necessarily tell you whether you're actually positive or negative. So that is the difference. And personally, I've had, I've been vaccinated 3 times. I've had a booster dose. And prior to the first dose that I had to do an antigen test. And why did I do that? Because I was actually infected. I was, very sick with the virus, prior to all these vaccines were made available. But that antigen test did actually, affirm or did actually say, yes, actually I had antibodies, still available to protect myself. So that is the difference. So at least the lateral flow test, my view is that has to be free everywhere around the world for us to feel a bit more safer, to be honest with you.
In Germany, you can buy an antigen test for home use for around 20 Rand. I mean, you make mention that in the UK, it's essentially free. How much of an impact does that have? Perhaps how much of an impact, and how best does it place, for instance, the UK and Germany in its fight and control, and also really understanding how many cases are active in the fight against COVID-19?
Yeah, I mean, from the scientific point of view, the antigen testing, particularly in the middle of pandemic, it's not particularly necessary, though it is quite helpful. But what we do need to know is, the number of infections that are occurring per day, the number of infections that are occurring weekly, and then we also look at the effect of, these infections within the healthcare system, how many people are being admitted. As you can see, perhaps you hear the numbers in the UK that are beginning to go up. And we see this by looking at the test, literally, not necessarily the antigen testing. So really the test is really important for any country in the world. It's really, really important. That's the only thing that's going to give us a precise idea of what are we dealing with here. But also, as I've already mentioned, that is the thing that is going to give us an idea of what kind of mutation or variant are we actually dealing with here, and how prepared should we be, based on that. If you recall on the Omicron variant, the scientists were extremely worried because when they looked at it, it looked, quite horrific, quite frankly. It looks a lot different from the original virus. And they've only determined that, or they could only determine that by sequencing the actual tests that were done. So really, again, the answer to your question is the tests are really, really crucial, are really, really important. And I really wish, every single government around the world should be able to avail this test, to everyone, so that we can actually really know what sort of numbers are we talking about in terms of the COVID infections around the world.
And essentially, I mean, we here in South Africa are expecting an announcement from the Competition Commission to announce a change in COVID-19 test pricing, and also looking at how the process should really be simple, accessible, and cheap. Do you perhaps think that the big pharmaceutical companies and the laboratories are capitalizing on the COVID-19 pandemic, especially here in South Africa, where the testing process is simply unaffordable?
You know what, at the end of the day, these so-called big pharmaceutical companies, they are in business. They're not going to simply, manufacture things for free, for the whole world. So I think the government, individual government in each country, they really need to get involved. If you, again, going back to how the vaccine was actually manufactured, it was almost manufactured in 9 months, which is quite historic. And the reason why that was the case is because, European governments, the USA as well, they helped, they kind of, motivated these pharmaceutical companies to engage, because they knew that we are dealing with a serious pandemic, that is really can be catastrophic to human lives. So really, it's really important, not just for the pharmaceuticals perhaps to look into this, but I think, in my view, is what really is important is, the political aspect. We know this, by and large, has been led, has been pushed by politics. The scientists, they give advice, as much as they can, but the ultimate decisions tend to be taken and would be taken by the actual government. So really, again, my view here is there has to be a thorough, proper, collaborative involvement of different governments for us to be able to effectively understand and deal with this. There is no point, pointing fingers at, the capitalists or perhaps the big pharmaceutical companies without actually looking at, the policymakers, because these are the people who are capable of changing things to make this thing equitable globally.
Very well. Thank you so much for your input, medical science researcher Patrick Jolomba, speaking to us there from the UK about the big differences when it comes to the pace of testing, accessibility in terms of COVID-19 tests, and knowing your status. Of course, we are expecting here in South Africa an announcement by the Competition Commission when it comes to the COVID-19 price testing. And